So today's session is congestive heart failure, also known as congestive cardiac failure. Congestive heart failure, also known as congestive cardiac failure. So here the heart is unable to perform its functions. The heart is unable to perform its function. So it is a clinical syndrome in which developed due to accumulation of blood in front of the left as well as right part of the heart. So left as well as right part of the heart. So simply it is a disease of heart in which the heart is unable to perform its function. It is a clinical syndrome in which developed due to accumulation of blood in front of the left as well as right part of the heart. Okay, so let's see a flow chart to get some details in clear. To get some details in clear. So here, so what is happening here? So it is there simply there is a heart damage is there, overload in the ventricles, decreased ventricular contraction. So what happening main in the case of congestive heart failure? So there is a damage to the heart, and that is because of excess overload of fluid of blood in the ventricles and decreased ventricular contraction. So ventricular contraction capacity తగ్గిపోతుంది, అలాగే వెంట్రికల్స్ లో ఓవర్లోడ్ పెరుగుతుంది, హార్ట్ అనేది డ్యామేజ్ అవుతుంది. సో దీనివల్ల ఏమవుతుందంటే కనుక బికాస్ ఆఫ్ దిస్, what is happening? So because of this there is a tachycardia, increased heart rate more than 100 beats, and dilation of ventricles. When ventricles dilated, the permeability of fluid increases. So permeability of fluid increases, overload of fluid also increases, and also myocardial hypertrophy, increase in the size of cell, myocardial hypertrophy, and this leads to decreased cardiac output. So as you know, cardiac output is nothing but the amount of blood coming out of the heart for each beat. So cardiac output is important throughout the body. So the cardiac output is essential for the brain functions. Cardiac output is essential for the GIT function like absorption and digestion. And cardiac output is essential for the kidney to perform its filtration. So like that, cardiac output is essential. If cardiac output is decreases, if disease happening to the heart, other body organs also will affected. So once heart is affected, it may develop into the multi-organ disease, because heart is essential to send cardiac output to the all bodies. So here cardiac output is decreasing. So when cardiac output is decreases, decreased renal perfusion. So perfusion into the kidney also decreases. The cardiac output to kidney also decreases. That leads to increased sodium retention. So when sodium is retention in the body, along with sodium, water also enter inside. Because of that, increased osmotic pressure and leads to increased ADH action. What is ADH? Antidiuretic hormone. Okay, very good. So that is antidiuretic hormone. The name itself indicating it opposes urination. So if urination opposing means still body fluids are inside the body only. So simply what is happening? Increasing water reabsorption. This increasing water reabsorption leads to overload of fluids that develops edema. The edema in the heart. So edema in the heart is nothing but accumulation of excess fluids in the body.
Sir, also renin-angiotensin system also activate.
Yes, thank you. Kindly, if anything is there, we will discuss in the last of the class. Yes, you are correct. There is a renin-angiotensin-aldosterone system. So as you know, renin-angiotensin-aldosterone regulates blood pressure in the body. If blood pressure increases, if blood pressure decreases, both will be under the control of renin-angiotensin-aldosterone system. Both under control of renin-angiotensin-aldosterone system. And even in your basics of anatomy also, you will go through the renin-angiotensin aldosterone system. So here simply what is happening, heart is damaging, there is a overload in the ventricles and also decreased ventricular contraction. The contraction capacity of ventricles decreases. So the fluid accumulating in the heart and enlargement of heart. If that fluids are not eliminating from the heart or from the body, so there is a chance of heart failure. If heart failure means it is dangerous to the patient, and if heart get diseased, it become multi-organ failure. Become multi-organ failure. So this is simply about a small basic point how the congestive heart failure will happen. So what is happening in this condition? So there is a lot of things to discuss, but just I am giving a small basic point. And based on that, we will discuss the pharmacology of drugs in the treatment of congestive heart failure or congestive cardiac failure. So the main thing is what is happening. Excess fluids are accumulated in the heart, nothing but myocardium. So we have to eliminate that excess fluid by using different class of drugs. By using different class of drugs. So regarding pharmacology, the interesting thing I have to make always is mnemonics. So mnemonics అనేవి మీకు చాలా యూజ్ అవుతాయి, ఈజీగా మీరు గుర్తుపెట్టుకోవడానికి కూడా అవకాశం ఉంటుంది. So the classification of drugs for treatment of congestive heart failure. For treatment of congestive heart failure. So the mnemonic is BANDS BPC. So B means beta blockers. B means beta blockers. So in the beta blockers also, drugs like carvedilol, metoprolol, again carvedilol, bisoprolol, nebivolol. So all these are the beta blockers used in the treatment of congestive heart failure. Used in the treatment of congestive heart failure. And next is aldosterone antagonist. So in the later I will discuss clearly why this class of drugs used, how they produce action in the treatment. So ప్రతి డ్రగ్ గురించి కూడా ఫర్దర్ గా మనం డిస్కస్ చేద్దాం, డోంట్ వరీ. అండ్ నెక్స్ట్ క్లాస్ ఆఫ్ డ్రగ్ ఈస్ aldosterone antagonist. Aldosterone antagonist like spironolactone, like eplerenone. And next, natriuretic peptides. These natriuretic peptides naturally present in the body. The name itself indicating they promote natriuresis, increases elimination of sodium.
Sodium.
Increases elimination of sodium. So based on that, ANP, atrial natriuretic peptide, BNP, brain natriuretic peptide, CNP, C type of natriuretic peptide, DNP, dendropsis natriuretic peptide. So there are different types are there based on their location, but all they perform natriuresis. Natrium means sodium, and uresis means elimination of sodium through the urine. Elimination of sodium through the urine. So as you know, so here in CHF, there is retention of sodium. Along with sodium, water also coming. If you eliminate the sodium, sodium and water go outside of the body through the urine. So there is a decreased fluid volume and decreased fluid load in the heart also. సో ఎప్పుడైతే సోడియం వాటర్ బయటికి వెళ్ళిపోతున్నాయో బాడీలో ఫ్లూయిడ్ వాల్యూమ్ తగ్గిపోతుంది, తద్వారా హార్ట్ మీద లోడ్ అనేది కూడా తగ్గుతుంది.
Sir, another example is nasiritide. Nasiritide is natriuretic peptide.
Yes, dear students, dear Dheeraj, please, because you know the things, but remaining people are not know. So kindly listen. If anything is there, you can we can discuss in the class. Okay, last minute of the class. I hope you can understand.
Yes, sir.
Okay, thank you. So next class of drugs is diuretics. Yes, diuretics are very essential in the treatment of congestive heart failure. Very essential in the treatment of congestive heart failure. Why? Because diuretics, name itself, they increase the elimination of fluids through the urine. So here the main reason is there is a excess fluids in the heart accumulated. So to eliminate that excess fluid, first we have to start with the diuretics. First we have to start with the diuretics. For example, diuretics like loop diuretics are there, thiazide diuretics are there. So regarding diuretics, we will discuss separately in the topic of diuretic. Okay. And next is sympathomimetic amines like dopamine as well as dobutamine. Both dopamine and dobutamine having nothing but they produce dilation on the renal arteries and increase the glomerular filtration rate. So dopamine, dobutamine రెండు కూడా renal artery ద్వారా blood flow ని increase చేసి glomerular filtration rate ని increase చేస్తాయి. So glomerular filtration rate ని increase చేస్తాయి. And next, vasopressin receptor antagonist. So we have to block vasopressin receptor. Vasopressin also known as antidiuretic hormone. So the drugs like tolvaptan, which is a selective vasopressin type 2 receptor blocker, and conivaptan, it is a non-selective, can block V1 as well as V2 type of vasopressin receptor. So vasopressin, vaso means blood vessel, pressin means rise the pressure. So vasopressin on the blood vessel increase the pressure, and vasopressin also known as ADH antidiuretic hormone acts on the kidney and prevent diuresis, antidiuretic hormone. So vasopressin, there are two types of vasopressin receptors are there, and both are belongs to the G protein coupled receptors. Both are belongs to the G protein coupled receptors. Next, phosphodiesterase enzyme 3 inhibitors. Phosphodiesterase enzyme 3 inhibitors. So the examples like ambrinon as well as milrinone. Ambrinon as well as milrinone. Next, cardiac glycosides, that is digoxin as well as digoxin. So these are naturally from the cardiac glycoside, nothing but digitalis species. And apart from all these drugs, morphine is one of the drug for acute treatment of associated pulmonary edema. So pulmonary edema associated with the congestive heart failure. So if congestive heart failure is related or combined with pulmonary edema, so the patient is having congestive heart failure along with pulmonary edema. In that condition, morphine also can be used in the treatment. So up to now, this is the classification of drugs for the treatment of congestive heart failure, nothing but congestive cardiac failure. Congestive heart failure, nothing but congestive cardiac failure. Okay, next, digitalis. Nothing but we will discuss in detail regarding the digitalis. So cardiac glycosides are steroids having ability to exert specific powerful action on the cardiac muscle. So as you know already, so digitalis from the natural source of the plant, they having stimulant effect on the cardiac muscle. They can stimulate the cardiac muscle and shows a positive effect on the heart contraction. They increase the tone of cardiac muscle, means cardiac muscle యొక్క strength ని increase చేయగలవు, దాని యొక్క forceful contractions ని increase చేయగలవు. They also exert diuretic action by increasing renal cardiac output. So what they are doing, they exert diuretic action by increasing renal cardiac output. So kidney దగ్గరికి ఫిల్ట్రేట్ అల్ట్రా ఫిల్ట్రేట్ ఇంక్రీజ్ చేసి ఫిల్ట్రేషన్ ఇంక్రీజ్ చేస్తాయి అన్నమాట. తద్వారా ఏమవుతుంది, యూరిన్ ద్వారా ఎక్సెస్ ఫ్లూయిడ్ అనేది బయటకు వెళ్తుంది. డిజిటాలిస్ స్పీసీస్ లైక్ డిజాక్సిన్ యాజ్ వెల్ యాజ్ డిజిటాక్సిన్. Digoxin as well as digitoxin. So continuation is mechanism of these drugs, nothing but cardiac glycosides, mechanism of action. So actually it should be like flowchart, but just I mentioned as a points. Okay, so don't confuse, I will explain in clear manner. So first, digitalis binds with and inhibits, digitalis binds and inhibits sodium potassium ATPase enzyme. Sodium potassium ATPase enzyme, and it can increases intracellular sodium levels. It can increases intracellular sodium levels. So what is happening, it bind and inhibiting the sodium potassium ATPase enzyme. అంటే జనరల్లీ సోడియం పొటాషియం ATPase ఎంజైమ్ కనుక యాక్టివ్ గా ఉంటే, ఇఫ్ ఇట్ ఈస్ ఇన్ యాక్టివ్ పొజిషన్, వాట్ హ్యాపెన్? సో ద సోడియం విల్ గో అవుట్ and the potassium will come inside. So 3 molecules of sodium goes outside and 2 molecules of potassium come inside. But here what the drug is doing? It inhibiting the sodium potassium ATPase enzyme. So here sodium come inside and potassium goes outside. So జనరల్ గా మీరు గమనిస్తే కనుక ఏమవుతుంది? When the sodium potassium ATPase enzyme is active, it eliminate the sodium from the cell and influx of potassium inside the cell. But when this enzyme inhibited, ఏమవుతుంది? సోడియం అనేది సెల్ లోపలికి వస్తుంది, పొటాషియం అనేది సెల్ బయటికి వెళ్తుంది. సో దట్స్ వై డ్యూ టు ఇన్హిబిషన్ ఆఫ్ దిస్ ఎంజైమ్ ఇంక్రీజెస్ ఇంట్రాసెల్యులర్ సోడియం, సెల్ లోపల సోడియం కాన్సంట్రేషన్ పెరుగుతుంది. అండ్ డిక్రీజెస్ ఎఫ్లక్స్ ఆఫ్ కాల్షియం అండ్ విత్ సోడియం కాల్షియం ఎక్స్చేంజ్. అంటే ఏమవుతుందండి? సెల్ నుంచి కాల్షియం బయటికి వెళ్ళటం కూడా తగ్గిపోతుంది. సో సోడియం లెవెల్స్ పెరుగుతున్నాయి సెల్ లోపల, కాల్షియం లెవెల్స్ పెరుగుతున్నాయి. సో డ్యూ టు డిక్రీజ్డ్ ఎఫ్లక్స్ ఆఫ్ కాల్షియం, increased calcium concentration within the cell. So what is the cell here? Cardiac cell, myocardium cell. And increased calcium responsible for excitation contraction coupling. So ఎప్పుడైతే కాల్షియం పెరిగితే ఏమవుతుంది? There is a excitation contraction coupling increases, that leads to contraction of myocardium, that is positive inotropic, means number of contractions will be increases. Number of contractions will be increases. Okay, so what is happening? Due to inhibition of sodium potassium ATPase enzyme, there is an increased sodium concentration within the myocardium cell. When sodium concentration increases, indirectly calcium concentration also increases. That calcium responsible for contraction of the myocardium, that is positive inotropic, increases number of contractions in the heart. Increases number of contractions in heart. So ultimately what is happening? Because of this positive contractions or increase in contractions, there is an increased cardiac output. When cardiac output is increasing, the excess fluid from the heart is coming out. Excess fluid from the heart is coming out. So because of that excess fluid coming outside of the heart, the overload on the heart decreases. So heart లో ఉన్న లోడ్ తగ్గిపోతుంది, హార్ట్ అనేది చక్కగా పనిచేసుకోవడం మొదలు పెడుతుంది అన్నమాట. ఓకే, and there is another thing is interesting thing is there. So the digitalis can produce positive inotropic action, and digitally have vagomimetic action, decreases number of beats per minute, negative chronotropic. అంటే నెంబర్ ఆఫ్ బీట్స్ తగ్గిస్తుంది. ఎలా తగ్గిస్తుంది? ఇట్ ఈస్ ఎ vagomimetic. It increasing or mimicking the vagus nerve action. So if vagus nerve action increases, what will happen? If vagus nerve innervated, parasympathetic nervous system stimulated. If parasympathetic nervous system stimulated, acetylcholine will releases. So the action of acetylcholine on heart is decreasing number of beats. Decreasing number of beats. By this, digitalis can produce positive inotropic action by inhibiting sodium potassium ATPase enzyme. And the same digitalis can produce negative chronotropic action by mimicking the vagus nerve by increasing the acetylcholine. The role of acetylcholine on heart, decreasing number of beats. Okay, so let's move forward. So for further, at low concentration digitalis, that is therapeutic concentration. So therapeutic concentration is nothing but the concentration shows beneficial effects. The concentration shows beneficial effects. So at low concentration, that is at therapeutic dose. Therapeutic dose is nothing but a beneficial dose, which shows positive effect. So at low concentration, digitalis, that is at therapeutic concentration, decreases automaticity, increases resting membrane potential by vagal action in atria as well as atrioventricular. So decreasing the automaticity of heart as well as increasing resting membrane potential by increasing the vagus nerve action. So as I already I told you, when vagus nerve is innervated, acetylcholine releases, acetylcholine decreases beats in the heart. So at a therapeutic dose at initial concentration, it is showing good action, nothing but beneficial effects. Beneficial effects. But at high concentration, digitalis increases automaticity in myocardium and increases sympathetic activity, results in atrial as well as ventricular arrhythmias. Due to this, it is categorized as narrow therapeutic index drug. So therapeutic index is nothing but it shows difference between the beneficial effects as well as toxic effects of a drug. So therapeutic index is nothing but a racial difference between beneficial effects versus toxic effects of the drug. So, and here it is digital is, please, I will explain. So here digital is, it shows good action at initial doses, but when dose is increasing, it shows toxic effects. So then it is called as narrow therapeutic index drug. So initially the drug is showing good effect, but when dose is increasing, what is happening? It's showing some toxic effects, and that's why this drug is called as narrow therapeutic index drug. But this drug should be used ఎందుకంటే ఇది ఎమర్జెన్సీ డ్రగ్ కాబట్టి ఇది ఖచ్చితంగా యూజ్ చేయాలి. మరి ఈ డ్రగ్ యూజ్ చేయాలంటే ఎలా? ఈ డ్రగ్ యూజ్ చేసేటప్పుడు మానిటరింగ్ ఉండాలి. సో దేర్ షుడ్ బి ఎ మానిటరింగ్. సో ఆల్రెడీ వెన్ డోస్ ఈస్ గివెన్, సో హౌ మచ్ డోస్ ఈస్ present in the blood already, so when we have to give again. So the problem with narrow therapeutic index drug is we have to be monitored. So monitoring should be there because we are caring for the patient. So always should be in the monitoring. Even drugs like digitalis, drugs like lithium carbonate, drugs like penicillin G, drugs like theophylline, and drugs like barbiturates, all these are comes under narrow therapeutic index drug, and there should be a monitoring should be there. And digitalis can prolong the PR interval, can reverse the T wave and depress the ST segment. So these are the effect of digitalis on the ECG. These are the effect of digitalis on the ECG. So regarding pharmacology, as you know, basics also very, very essential, like therapeutic index. Next, side effects. What are the side effects of digitalis? So what are the side effects of digitalis? Anorexia, that is loss of appetite due to CTZ stimulation, that is chemoreceptor trigger zone. Chemoreceptor trigger zone. So generally, you know.
Sir, could you please explain how it prolongs PR interval and depress ST segment?
Okay, don't worry, I will explain later. So anorexia, that is because of stimulation of CTZ, chemoreceptor trigger zone. And next, effect on CNS is hallucination, visual disturbances, confusion, restlessness, and other one is gynecomastia. So gynecomastia means abnormal enlargement of breast in the male. Abnormal enlargement of breast in the males. And at high doses, digitalis can precipitate ventricular arrhythmias. At high dose, the digitalis can precipitate ventricular arrhythmias. Okay, so these are the side effects of digitalis. These are the side effects of digitalis. And next, applications of digitalis. It is used in paroxysmal supraventricular tachycardia. So the condition in which the heart rate or heartbeat is more than 200 beats per minute. There is a more than 200 beats per minute, that is PSVT, paroxysmal supraventricular tachycardia. In that condition, digitalis will help. And atrial fibrillation. So in this condition, verapamil, propranolol also useful. And in case of atrial flutter, so atrial flutter, atrial fibrillation are the condition in which there is a heart rate is more higher, and these are the emergency cases. So ఈ రెండిట్లో కూడా హార్ట్ బీట్ చాలా ఎక్కువగా ఉంటుంది. ఇది ఎమర్జెన్సీగా కంట్రోల్ చేయాల్సి ఉంటుంది by using important drugs. And as you know, the digitalis is one of the major drug of choice for congestive heart failure. So it is one of the major drug of choice for the treatment of congestive heart failure. Yes, there are many drugs can cause gynecomastia, and in that digitalis is one of the drug. Digitalis is one of the drug. It can cause the gynecomastia. And next, so what happen if digitalis concentration is more or digitalis concentration become higher? There is an antibody that is digoxin, that is nothing but digoxin antibody digoxin used in severe digitoxin toxicity. So severe digitalis toxicity, and it acts by neutralizes circulating digoxin and digitoxin, rapidly reverse the toxicity, but it is a very expensive drug. So for general information, it is a very expensive drug. So this is simply regarding the pharmacology of the digitalis, nothing but drugs like digoxin as well as digitoxin. So remember, the important thing is the antibody is disease-bind. The antibody is disease-bind. And next, sympathomimetic amines. Next is sympathomimetic amines. So as I mentioned earlier, sympathomimetic amines, they increase the glomerular filtration rate and increase the elimination of body fluids from the body, and decreases fluid content in the heart and decreases overload on the heart. And let's discussion regarding this sympathomimetic amines. In that first one is dopamine. So dopamine. Generally, dopamine is a neurotransmitter you already know. Dopamine is a neurotransmitter you already know. And it showing actions in different doses. For example, at low dose, that is less than 2 microgram per kg per minute. Less than 2 microgram per kg per minute. So at this dose, the dopamine selectively dilates renal, mesenteric, as well as coronary arteries by acting on type 1 dopamine receptors. So these type 1 dopamine receptors present in the kidney, when these dopamine receptors are binding by dopamine, leads to increased glomerular filtration rate as well as increased urine output. Increased urine output. At this dose, what is happening? There is an increased glomerular filtration rate as well as urine output is increasing. By this, the excess fluid in the body is going outside through the urine. And next at medium dose. So next is at a medium dose. So medium dose, that is 2 to 5 microgram per kg per minute. So 2 to 5 microgram per kg per minute.